So, everyone, today we are doing a chronic vitiligo patient who has been stable for 13 years now. So, what we are trying to do is first we had applied a topical numbing agent. We did two uh, sittings with topical numbing agent, but then the patient is not comfortable and requested for a local anesthesia under the skin. So we are giving him a local anesthesia in the upper dermis of the skin using a blunt tip cannula so that it doesn't hurt much and we can continue our job. Our very special technician is here, Miss Anju Kale, and she's the best at what she does. And this is what she's doing today. And I hope she learns a lot about it. She's under training for Botox, as well as mesotherapy, as well as stem cells. So I hope one day she will not require me to do all these small jobs and will be able to take care of anesthetizing the patient's leg with local anesthesia. Topical anesthesia, putting it in the epidermis so that when the two coats of the color have been done, this is what we normally call a permanent makeup. But patient had gone in for melanocyte transplant, which was not a great success. So he came to me and he asked me if I could do it, and I told him of course I can do it for him. And that's what we are doing today, giving him local anesthesia all over so that his next hour he will be comfortable. This is a blunt tip cannula that I'm using. More local, please.
No, sir. Only look and
Give me another. So we are doing local anesthesia. So we're gonna cover entire thing. This patient has taken more than, I believe, 5 hours now to cover this area of his leg. We'll be doing 3 coats today at 1 mm, at 1 mm, 0.8 mm, and 0.8 mm, so that the color comes nicely. And the color that we choose are American colors, and they're the best in the lot. All of them are FDA approved. And there is some discomfort, some level of discomfort is there. You can see the redness, but it's bearable. The patient is very brave, he's bearing it very well. And all we have to do is one more sitting of this, and he'll be fine. Sorry, you'll be fine, bacha. 10 cc's. Bus, bacha, bus. We're almost done. 10 cc's. So what we do is we either use a long needle that comes with this 10 cc syringe, or we use the cannula. So wherever cannula was supposed to be used, we have used, and now a smaller area will be covering with uh, Anavane, that is Marcaine, that is Bupivacaine, which is a long-acting local anesthetic, and he'll be pain-free for at least 6 hours after this. And tomorrow he has this area to be done, and we'll do this area in 2 sittings. And anyone who is suffering from vitiligo, which is stable, almost done बच्चे, बेटा उल्टा लेट जाओ. That's a lot of area. So our technician Miss Anju has covered a lot of ground, and the patient is in a bit of pain, but he'll be fine in no time. Clean it and get to work, girls. Your 2 of you can finish this as soon as possible, and tomorrow our patient will come back for the next sitting. So he's totally numb now, nothing to feel. Take nothing to feel, and he'll be able to do his work very nicely. He can even go to his office tomorrow, nothing to worry about. And that's it. This area is entirely numb, and that is this last sitting. And we're gonna increase the density of the darker color this time and reduce the intensity of lighter color, because remember, the color comes off a little, and the second sitting you get a proper color. ठीक है.